Greetings from Mumbai, and thank you to the Shoulder 360 team for the invitation. We know that partial tears are generally seen in the elderly and the young patient, and they present with pain, impingement. Unfortunately, physical examination is not accurate in diagnosing partial tears, and also these high-grade tears, which are initially asymptomatic, tend to become symptomatic with time. The MRI is the investigation of choice compared to an ultrasound, and the Ellman and the Schneider classification both have a fair inter-observer reliability. The non-operative treatment is preferred for a non-dominant shoulder involvement if the tear is atraumatic and if low grade, especially less than 50%. It involves NSAIDs, plus minus subacromial injections, but importantly physiotherapy, posterior capsular stretches, rotator cuff and periscapular exercises. And generally a trial of 3 to 6 months helps a vast majority, but importantly periodic follow-up is necessary because of the risk of progression. The operative treatment is indicated for a dominant shoulder, a traumatic type of injury, and a high-grade tear. And the 50% rule is very popular in decision-making. There are various surgical options. Firstly, debridement. It is generally reserved for the young, active individual because repairing has shown that they don't return to the same pre-injury level of activity. It is also indicated for incidental tears where you're operating for another reason. The in situ repair